Hi, my name is Talisha Higgins, and I am doing a persuasive speech on the importance of being tested for sleep apnea. Do you have trouble breathing while you're asleep? Sleep apnea can be developed and affect any individual at any age. I'm a licensed registered sleep technologist, and I have studied and practiced sleep medicine for over 17 years. Being tested for sleep apnea can improve your quality of life. There are risk factors that could happen or that you can develop with sleep apnea. The first thing is family history and genetics. The structure of the airway, cleft lip and palate, and Down syndrome could be some factors of developing sleep apnea. Also, age and sex. Women develop sleep apnea more than men because of the tissue that we carry around our throat areas and our bosom areas. When we're carrying here in our bosom areas, it suppresses the diaphragm, so we can't breathe out as much as we need to while we're asleep. Also, health conditions like the endocrine system, to where you may produce too much insulin, too less insulin. Your TSH meaning your thyroid condition could cause sleep apnea as well, along with heart and kidney failure and obesity. Also, large tonsils and a thick neck can obstruct the airway and cause you not to breathe as well while you're asleep. Another thing could be your lifestyle habits. Drinking alcohol sedates the central nervous system and could cause sleep apnea. Smoking could cause sleep apnea as well, and drug usage. Being diagnosed with sleep apnea, you would have to do a few things. First thing that you would have to do is use a sleep diary. With a sleep diary, you would keep up with how your sleep patterns, how you're sleeping, how much you're sleeping, how many times you're waking up during the night, and when you're getting up during in the mornings. The next thing that you would do is have an Epworth sleepiness scale. An Epworth sleepiness scale is when you're being tested to see how likely are you to fall asleep or doze off during a number of things, say like sleeping or sitting and reading. How likely would you fall asleep? Would you have a high chance, a medium chance, or a slight chance of falling asleep, or even driving an hour away? Would you feel sleepy while you're driving? The last thing that you would do is do a sleep study, which is a polysomnographic study. That study, you would go into a sleep lab or a sleep center and be hooked up to many wires so that you can be tested to see if you have sleep apnea. In coming to conclusion, sleep apnea can improve your quality of life, because when you do have sleep apnea, what happens is you're not getting any restorative sleep. Every time you stop breathing and you start back to breathe, your brain has a 3-second or more shift in it, which is called an arousal. And that arousal is equivalent to waking you up. So if you're having 20 or more of these episodes an hour, you're not getting any sleep. You're not getting into the sleep stages that are recuperative for the body nor the brain. Your oxygen levels are dropping, which is causing your heart to work overtime, trying to get oxygen to where it needs to be. And eventually your heart will overwork itself. And once it overworks itself, it can cause you to have a deadly heart arrhythmia. Once you get into that deadly heart arrhythmia, it can cause death. Sleep apnea will cause you to be very tired, cause anxiety, depression, irritability, low libido, hormonal problems, weight gain, memory loss. And when those things can cause you to be very tired. And once your cognitive skills are lower or lessen, and you just won't have a good quality of life. And ultimately, you could die. Adequate, restful, recuperative sleep a day could keep illness and death away.